Postmortem stain. Postmortem stain is the extravascular blood discoloration brought about by the hemolysis of blood. It is known as postmortem hypostasis, postmortem coagulation, and postmortem biopsies. Once a person dies, the circulation comes to a halt and the blood starts moving towards the dependent regions due to gravity. This effect results in a reddish-blue staining of those dependent regions known as livor mortis, or postmortem staining, postmortem lividity, or postmortem hypostasis. After a few hours, the blood no longer moves and the livor mortis is fixed. No matter how the body is positioned, the lividity pattern will show how the corpse was originally laid. This process starts 1 to 3 hours after death has occurred. This staining will increase in size and spread over the dependent regions in 4 to 6 hours and be fully developed in 6 to 8. Lance Ray wrote in Viewpoint, "We have to face that fact that any postmortem staining is a negative situation that directly reflects on the funeral home, and every step should be taken to reduce its presence in all cases." This was from the Viewpoint American Funeral Directors magazine, March 2017. Once the heart stops beating, whether due to homicide or natural causes, the body enters the first stage of death. Blood drains from the capillaries to the larger veins in the parts of the body closest to the ground. This process is called livor mortis. Embalmers call it the postmortem stain. The overall skin, once pink and full of color due to oxygen-laden blood, is now pallid except for the deep purplish-red bands where the corpse touches the ground. It can involve skin, tissues, and all viscera. In a body that was supine at death, it appears on the back, ears, and the posterior aspect of the body except for the pressure points of the buttocks. The stain starts as a series of mottled patches, which increase in size until fully developed within 6 to 8 hours. Why is it important to understand as embalmers? Caleb Wilde wrote that he had a case where the decedent didn't look himself because at death he was face down, and they had to use a lot of makeup to cover the stain. Therefore, when his mother saw him, she didn't think it was her son. The way to test if the staining is fixed is to press the area where the blood pooled. If the skin turns white or blanches, the livor mortis is unfixed. Death investigators can use that window to help approximate the time of death. They can tell the time of death, the position of the body was laying at the time of death, and establish a cause of death through the postmortem stain. The difference between livor mortis and postmortem stain is that the livor mortis is intravascular and can be treated, and postmortem stain cannot be cleared and is extravascular. The appearance of postmortem staining depends on various factors, including the amount of blood at the time of death. The staining is less marked in deaths with blood loss, and it is more intense in asphyxia deaths. Those deaths caused by poisoning will have a distinct coloring. Carbon monoxide poisoning will result in a cherry red staining. Cyanide poisoning has a pinkish colored stain. Poisoning by nitrate has a brown staining. We as embalmers need to understand the postmortem staining so that the best results can be achieved in the embalming process. Anticoagulant fluids will need to be used to help with drainage and help remove the postmortem discolorations. Some fluid manufacturers incorporate blood solvents and thinners to aid in the removal of extreme lividity that is about to become postmortem stain. These fluids do not guarantee removal, but could help lighten the stain, therefore deflecting a negative situation for the funeral home and the staff.